Hi, welcome to This Week in Medicine. Thanks for joining us. It's December 6, 2021. It's been an interesting week. This is brought to you by the Foxhall Foundation. We are a 501c3 foundation with a wellness center, a nutritionist who is doing an awesome job. Many of you have consulted with her already, courtesy of the Foxhall Foundation. She is also taking clients apart from the Foxhall Foundation sponsorship. So contact Carrie and see if you'd like to do some nutrition work with Carrie, especially after this long COVID pandemic. We also have at our Wellness Center Kenzendo Karate, Key Adult Movement classes, and Tala's Yoga Wednesday and Saturday. What stressed you out this week? What came into the inbox of Dr. Thomas's office? Still planning for Christmas and New Year's? How do we do this? Well, it's hard because Omicron gives us some new challenges and we don't have all the answers yet. There's still a new wave of COVID in Northern and Eastern Europe. Again, the winter holidays have been stressful already with Thanksgiving, but we really probably have not seen the spike in cases that we had last Thanksgiving, and that is in large part, of course, due to vaccination. Will COVID vaccines prevent Omicron? We don't have a really good data set on this yet. And it actually looks like people who have had COVID already, infection, disease, are at risk for infection with Omicron. Some more good news from the University of Michigan, which won the Big Ten on Saturday night. So we'll see that coming back again in a couple of minutes. It is my alma mater. Omicron COVID variant is in the United States. It's probably at least 20 or 30 states right now. And of course, everyone says that there are cases of Omicron that likely have not yet been detected. So we can accept the concept of community spread of Omicron. This virus is spreading in the United States right now. Vaccine for kids, and today antibody therapy from Lilly has been approved. So antibody therapy can be used for children. I think that was just approved today. How to interact with the unvaccinated is still a challenge. We really don't want to have to answer this question. We want everybody vaccinated. It's safe, it's effective, and really it's probably more effective than the influenza vaccine. We should apply mRNA technology to see if we can make a better flu shot. So again, Michigan, the leaders and the best. One more weekend of great Michigan football, but again, in the setting of a surge in the state of Michigan. So again, the leaders and the best, they won another football game on Saturday night. Very exciting. They're going to the college football championship. They're in the Final Four, I guess you would say. But more interesting news out of Michigan is an influenza outbreak on college campuses. We actually had one locally on a college campus. This is an interesting finding because we have not seen this before. The University of Michigan had an influenza outbreak, and I have a couple of students there, and of course my niece and other family members. We are all from Michigan. The CDC completed their report in conjunction with the Departments of Health in Ann Arbor on review of 745 influenza cases, 99% of whom were students. So again, this age demographic is going to be 18 to 24-year-olds, not older people. But in the 99% of cases that happened October 6th to the 19th, there were actually similar rates of infection for the vaccinated versus the unvaccinated, which is very interesting. So there were equal numbers. If you had the flu vaccine, it didn't look like it protected you. Why didn't it protect you? Well, because this H3N2 strain of influenza A, which is actually also what we saw in our area, detected on campus, had genetic differences from the H3N2 strain in the influenza vaccine. Remember, these genetic differences we have seen before, and even though scientists and vaccine companies do their best to predict which influenza strains will be dominant and what their genetic code is, sometimes they aren't quite accurate, and we wonder if that has something to do with decreased efficacy of the flu shot. So in this strain, there might have been decreased efficacy at the University of Michigan in this outbreak because of the genetic difference in the H3N2. There will be ongoing work to determine whether this will impact vaccine effectiveness for this season, but it's very interesting because you have a very well-defined group, 745 people. They're all about the same age. Half of them had flu shot, half of them didn't. So this is a great natural observational experiment, and this was published in the University Record, University of Michigan, and they closed out their study, which is very interesting and instructive. Does that mean that the flu shot doesn't work? No, it doesn't mean the flu shot doesn't work. Again, when we're coming to dealing with global pandemics and epidemic spread of influenza, flu shots definitely do work. They decrease caseloads. The Omicron variant still in the news, of course. We know where it started in South Africa in a very low vaccinated population. The Pfizer vaccine was returned because they're oversupplied with the vaccine there, so they don't need more of it. They just need to get it into arms. There are still travel restrictions, but as many of you notice, Omicron may not be as severe, as original Delta and previous COVID viruses. So are the travel restrictions going to be lifted soon? Looks like they probably will. It's a well-mutated virus. We'll talk about the mutations in a minute because we do have more data on the vaccine, on the COVID mutations in this Omicron. We still don't have enough data about the medications, the pills that are out, and Paxlovid has not been approved yet in this country. Omicron in South Africa, last week on Tuesday there were 4,300 cases. Wednesday, 8,500. Then by Friday, up to 16,000 Omicron cases in South Africa. That's a 375% increase in 72 hours. That far outpaces the increase that Delta took. So this virus is spreading rapidly, more rapidly than Delta did. There is an interesting research paper that was published this past week by a group that has a base in India and a base in Cambridge, Massachusetts. They're called Influenza. This physician researcher, Venki Sandarajan, was trained at MIT and trained at Harvard. He definitely knows what he's doing. So this paper has not yet been peer reviewed, but you will see this paper quoted frequently by people in the media, by our experts in public health. It looks like a very well done study, and certainly this researcher and his organization do a good job. This is validatable research. The idea is that a common cold virus might have combined in a host, maybe it was in Botswana, but ultimately ended up in South Africa, and that this virus became Omicron from a combination of COVID and some common cold genes. So if you look down here in the paper, this is the common cold. The HCOV 229E could have combined with the COVID to make Omicron. So there's some common cold virus genetics in Omicron, which might be accounting for the rapidity with which it is spreading. Dr. Tom Quinn, who's a global health expert from Johns Hopkins, mentioned in a grand rounds talk he gave, and I was trying to look this up 10 to 15 years ago, that the breeding grounds for viruses are urban centers of more than 20 million people. A patient asked me maybe 15 years ago, why am I so susceptible to colds and flus? The question isn't really why are individuals susceptible to colds and flus, it's where do you live and what is your exposure? If you're in an urban center of 10 to 20 million people, that is where these viruses breed. And so maybe this virus did start in Botswana, but ultimately it really took off in the highest populated province of South Africa. And that makes sense. It's densely populated. So our dense urban centers are breeding grounds for our viruses. And this is something Dr. Quinn and all the other global public health experts have been telling us for 10 to 20 years. So this is not new news. This is expected news. I just pulled this off the internet because I'm telling you, this is sort of a dirty secret nobody wants to talk about because it's a little too scary. Is it possible that there is a silver lining going on right now with Omicron? Is it rapidly killing off the Delta pandemic? This was from City AM, is a news source in London in the United Kingdom. You'll see a couple of these headlines. I just pulled it off because it was a very tantalizing headline when you see that extremely mild symptomatic Omicron could end our Delta pandemic. That would be very interesting. This is the slide that went around 2 weeks ago when Omicron first came out. This slide was everywhere. So I saw this repeatedly when I was doing research for the talks. This is the original beta. This is our Delta spike in South Africa. And look what happened. B11529 is Omicron. Look at the speed with which Omicron took off. And the last date on this was, well, here you'll see December 13th. I don't have the blue mark, but I would bet if I could find this slide that we probably are all blue, because Omicron, which is B11529, has taken over where Delta left off. So this slide is dramatic because it does show the rapidity with which Omicron has displaced Delta in South Africa. Will that happen through the rest of the world? Vaccine hesitancy, again, is a big problem, not just in the United States, but globally. Vaccine hesitancy in the face of a displacement of Delta by Omicron. We still want people to get vaccinated. We cannot be sure that Omicron is going to displace Delta. And in this country, it certainly hasn't. And people are still dying every day, mostly the unvaccinated. So don't take too much solace in Omicron replacing Delta. Get your vaccine. Anyone over 18 can get a vaccine. I had a patient today who told me that she was denied a vaccine because she didn't meet criteria of being over 65. She doesn't have to meet criteria of being over 65. If you're over 18, you can get the booster. So I told her, you don't need an order. I'll give you one to take to the pharmacist, but you may want to tell the pharmacist they need to update their criteria because anyone can get a booster. More updates from the University of Michigan. So I already gave you an update about the influenza outbreak at University of Michigan. Johns Hopkins Grand Rounds this week was given by Dr. Carruthers, who is the chairman of medicine at the University of Michigan. I asked him if I could use his slides. He very kindly said yes. You may know that every week Johns Hopkins broadcasts their medical grand rounds, and I'm hosting it at our local hospital so that everybody can see it and learn what's happening in updates in academic medicine. So Dr. Carruthers is a gastroenterologist, and he talked about what we're eating and ingesting and how it affects our gastrointestinal tract. He had this really nice slide, high fructose corn syrup. There's the United States. We are a big producer and user of the pie of high fructose corn syrup. These are the rest of the countries represented in those pie wedges. There's the syrup. The syrup's in the ketchup. The syrup is in all of these food products. It's not good for you, long and short. High fructose corn syrup may trigger some inflammatory activation. It is associated with getting metabolic syndrome if you eat enough of it, obesity, diabetes, and there is a strong link with high fructose corn syrup and increased risk for colorectal cancer. Also causes colitis, inflammation of the colon, and NAFLD, non-alcoholic fatty liver disease. So basically, you don't want high fructose corn syrup. He also talked about artificial sweeteners. If you remember a couple of weeks ago, I also had a slide with pictures of artificial sweetener packets. Artificial sweeteners are not free. There's a cost to these. And I got a lot of emails from patients who are concerned about their artificial sweetener consumption. I'm not telling you not to eat them at all. Just consume them wisely. It can't be a free-for-all. There are issues with artificial sweeteners, and we don't have the whole story. Now this slide is old. The research was from 2014. There's Dr. Carruthers in the screenshot. The most important thing about this very busy slide is that non-caloric artificial sweeteners seem to drive glucose intolerance. So remember when we talked about the hemoglobin A1C a couple of weeks ago when we were talking about Diabetes Awareness Month? This is the hemoglobin A1C here in the red bars, right there, for somebody who is not consuming non-caloric artificial sweetener. These are the bars right next door for people who are. So the hemoglobin A1C is higher in those who consume NutraSweet, saccharin, sweet and low. Why is that? Because something is happening in your gut when you eat this stuff that may cause you to have an inability to metabolize sugar and make you more pre-diabetic, not less. Again, this is somewhat old data. We've been talking about this for a number of years. What are artificial sweeteners doing to your gut to prevent you from being able to digest sugar and becoming more pre-diabetic? The summary from his talk was there are vast effects on the gut to your overall health. High fructose corn syrup is associated with the metabolic syndrome. The metabolic syndrome is a syndrome of high cholesterol, high sugar that can lead to cardiovascular disease. Also, high fructose corn syrup can cause colitis, and so can artificial sweeteners. So if we've talked before about your complaints of abdominal pain, gas, digestion issues, I have suggested to many of you that you look in your diet for your artificial sweetener consumption and try and cut it out and see if that does something to relieve some of your digestive symptoms, diarrhea, bloating, constipation. It can even be caused by this stuff. So just look at your artificial sweetener intake. If you're trying to decide if it is causing any digestive issues for you, just go off of it completely for 2 weeks and see how your digestive symptoms respond. He also talked about triclosan, which is in a lot of hand sanitizers and soaps and cleaners, which is a chemical that's pervasive. It's in our water supply, it's probably in all of our bodies, and it has not been well tested, and it also does have effects on our gastrointestinal tract. I didn't get into that. It was a good part of his talk. There are also many aspects that are unknown, as he said, and yet to be discovered, but this was a great talk. It was very helpful, and it confirmed some of the things we're suspecting about the manufactured and artificial foods that we ingest. Tony's tip of the week, again, I'm just going to re-emphasize, try to get your refills in before the long holiday. The controlled substances like the benzodiazepines, pain medication, and ADD medication have some regulatory rules. For some patients, you need to get those prior authorized every year. The holidays and weekends are slow for prescription refill. We use a 2-factor authentication process to get these prescriptions filled. Check for your annual prior auths. And finally, in the past couple weeks, there have been some serious problems with supply chain for Cipro, which is an antibiotic. It's a fluoroquinolone. So we cannot easily get Cipro. I think it's out in the area in all the pharmacies. Ativan and lorazepam also seems to be in decreased supply. I assume these are supply chain problems, and I think we will be seeing more drugs that will be included in this shortly. We had the same problem about 2 years ago when a lot of medications that are generic and manufactured in India and China were in short supply because the FDA had a halt on importing those drugs. So losartan and other blood pressure medications were in short supply. We generally got over it, but right now this is a tough problem. Fast pitch, December 1st, last week was HIV Awareness Day. Keep that in mind. You can always get an HIV blood test. They're very easy to get in the office. As part of military protocol, everybody's checked at least every 6 months in the military. It's an infectious disease. It's easy to look for. Analyze. I'm not saying limit. I'm not saying halt. Just analyze and look around in your diet for high fructose corn syrup and artificial sweeteners. Do an inventory. Do a personal inventory and see how much of this you are using because there may be effects on your gut that are not healthy for your gut. Continue to wear a mask, and there was one article this week I read that really did implore people again, and I implore you too, make it a good quality mask, a KN95 or a 95 mask. These are not hard to get. I have a KN95 filter inside my cloth mask. Obviously, I wear it all day, and I'm very used to wearing my mask. It does not bother me. Check the status of your prescriptions. We're getting to the end of the year. And you can get combined COVID, influenza, and respiratory syncytial virus nasal swabs. If you have a fever, chills, if you have a respiratory illness, we can check for all of these. There's a combined nasal swab for all of them, so just one time. Again, remember your pyramid of health. Remember to make sure all of these are working. You can do that at your annual physical. Just go through every single one of these. I tend to, when you come in for your physical, make sure that all of the parts of your pyramid are up to date. This is our book, You Can Prevent a Stroke. It's still available. Thank you for your attention and have a good week.